Piperine is the chemical that makes black pepper spicy. It can prevent inflammation and oxidative stress, and it holds promise in the treatment of diseases as diverse as diabetes, epilepsy, vitiligo, and Parkinson's. It may also increase metabolism and weight loss, improve cholesterol, enhance brain function, and reduce pain. Black pepper is the most widely used spice in the world. Long before scientific research explained how it worked, black pepper was used as a folk medicine to treat a variety of conditions and diseases, including rheumatism, influenza, muscle pains, chills, fever, migraines, and digestive problems. It was also used to enhance blood circulation and to stimulate the appetite. Piperine is the active ingredient in black pepper, and it's responsible for a lot of its effects. It's what gives the pepper its spicy, pungent taste. In pure form, it's a white or light yellow crystal powder. It tastes similar to pepper and accounts for 98% of the alkaloids found in the black pepper. It's also classified as a syn-amphimide. These are chemicals that have sedative, anticonvulsant, and antidepressant properties. Piperine has numerous potential health benefits. It can protect against inflammation, improve cognitive function, mood, allergies, cholesterol levels, and blood pressure. It's also an antioxidant, and it can improve the bioavailability of many other drugs and supplements. This means that our body can make use of them more effectively. Piperine has many potential effects on the body. It decreases inflammation. It can reduce the levels of cytokines that promote the inflammation, like interleukin-1 beta, TNF-alpha, and PGE2. And it can increase the level of cytokines that reduce the inflammation. It can increase the bioavailability of many drugs and supplements by inhibiting the detoxification enzymes that break down the drugs and increasing the drug substance absorption in the gut. Piperine may increase the body's ability to make effective use of many other compounds. It acts as an antioxidant. It acts directly as a hydroxyl and superoxide radical scavenger. It inhibits prostaglandins, or hormone-like fats, and this can help with diarrhea. It increases dopamine and serotonin in the brain. This can help to improve mood, cognitive function, and fight off neurodegenerative diseases. It can increase muscle metabolism by increasing adenosine triphosphatase, and it can increase the use of energy by the muscles and help with weight loss. It can increase the availability of several drugs and supplements. It's a potential antioxidant, anti-inflammatory, and sugar and fat-lowering substance, especially when it's combined with curcumin, and it has few mild adverse effects reported. Piperine was identified in 1979 as the first ever compound to enhance the bioavailability of other substances. In other words, the piperine increases the ability of the body to use nutrients and drugs. This means that lower or fewer doses of drugs can be used to achieve the same effect. This is very beneficial when it comes to drugs that have unpleasant side effects. Piperine stops the body from breaking down drugs by blocking drug metabolizing enzymes in the liver. It increases the number of drugs and nutrients absorbed in the gut by stimulating the gut transporters. For instance, piperine increased the bioavailability of curcumin, a compound found in turmeric, in rats by 154%, and in humans by 2000%. Piperine also increased the blood concentration and the persistence of an anti-seizure drug in 2 trials on 32 people, possibly by blocking the enzyme that breaks down the drug. It similarly increased the bioavailability of a muscle relaxant in another trial by blocking the enzyme CYP2E1. A herbal extract combining piperine and curcumin increased the bioavailability of the sedative midazolam, the anti-inflammatory flurbiprofen, and the painkiller Tylenol in 8 healthy volunteers. A drug delivery system composed of piperine lipospheres increased the bioavailability of both THC and CBD when compared to the FDA-approved spray Sativex in a small trial on 9 healthy volunteers. All the evidence suggests that piperine increases the bioavailability of many substances. Piperine can protect against oxidative stress by removing free radicals like hydroxyl and superoxide from the body. In a small trial on 20 people with pancreatitis, a combination of curcumin at 500 mg per day and piperine at 5 mg per day improved their antioxidant status, lower fat peroxidation and MDA, and higher glutathione levels. Combinations with the same proportion of curcumin and piperine also improved antioxidant status in 3 trials on over 100 people with metabolic syndrome, almost 100 people with chronic lung disease, and 40 people with osteoarthritis. Along with everyday risk factors such as pollutants and radiation, a high-fat diet can cause the production of free radicals. When piperine was given to rats that had been living on a high-fat diet, the number of free radicals decreased. It also increased the level of enzymes that neutralize free radicals. In a clinical trial on over 100 people with type 2 diabetes or metabolic syndrome, a combination of curcumin and piperine had anti-inflammatory effects, measured as lower C-reactive protein levels. However, the mix contained 100 times more curcumin than piperine. A similar mix also reduced inflammation in a clinical trial on 40 people with knee osteoarthritis. Piperine reduced both short and long-term symptoms of inflammation in rats. In rats with arthritis, piperine reduced the pain and the size of the swollen joint area, and it decreased inflammatory molecules. In rats with gum disease or periodontitis, the piperine reduced gum inflammation and bone loss. It also reduced the production of inflammatory molecules. It also reduced inflammation in mice with inflammation of the uterus. In mice with acute lung injury caused by lipopolysaccharides, piperine reduced the production of cytokines that cause the inflammation. It also reduced the accumulation of white blood cells and the buildup of excess fluid in the lungs. In 2 clinical trials on over 200 people with type 2 diabetes or metabolic syndrome, a combination of 1000 mg per day of curcumin and 10 mg per day of piperine lowered the total cholesterol and the LDL and VLDL cholesterol, while increasing the HDL or good cholesterol. Rats with a high level of fat and cholesterol in the blood were fed piperine for 3 weeks. Without a change in their diet, their levels of total LDL and VLDL cholesterol decreased, while the HDL cholesterol increased. As previously mentioned, the combination of curcumin 1000 mg per day and 10 mg of piperine improved oxidative, inflammatory and blood fat status in 2 clinical trials on over 200 people. Supplementation with piperine in rats with metabolic syndrome decreased blood pressure, improved glucose tolerance, reduced blood markers of oxidative stress and inflammation, prevented tissue damage and inflammation in the liver or fibrosis, and improved the liver function. In a clinical trial on 100 people with type 2 diabetes, a combination of 500 mg per day of curcumin and 5 mg per day of piperine lowered the blood sugar and it reduced liver damage. In diabetic mice, a low dose of piperine, 20 mg per kg of body weight, reduced blood sugar. However, higher doses increased the blood sugar. Vitiligo is a long-term condition where skin patches lose pigmentation. In a clinical trial on 63 people with vitiligo of the face, a combined therapy of piperine and narrowband UVB radiation enhanced the skin repigmentation. Multiple animal studies suggest piperine can boost brain function. For example, rats who were fed piperine learned faster and retained memories for longer. It also enhanced brain function in rats with Alzheimer's disease. Rats who were fed piperine had improved memory compared to control rats. And piperine protected the hippocampus and the cerebrospinal fluid from free radicals. It also caused the growth of new brain cells in the hippocampus, a brain area heavily involved in memory. Piperine had antidepressant effects in mice who were subjected to chronic stress. This effect was linked to the increased production of new brain cells and increased brain-derived neurotropic factor levels in the hippocampus. Similarly, another study showed a 2-week administration of piperine reduced depression in mice. It also raised levels of serotonin in the hippocampus and the hypothalamus. Depression is common in epilepsy. In rats with epilepsy, dietary piperine reduced the symptoms of depression by increasing serotonin levels. Piperine's ability to enhance the effect of other drugs is also helpful when it comes to depression. Resveratrol is a compound that can reduce depression, and this antidepressant works better in mice when it's combined with piperine. In mice with Parkinson's disease, piperine improved motor coordination. It also improved brain function and learning. Increasing dopamine levels is the most common way to treat Parkinson's disease. Piperine inhibits MAOA and MAOB, the enzymes that break down dopamine, possibly increasing the overall dopamine level in the brain. Piperine also prevented the death of dopamine neurons in mice. It protected the neurons because it's an antioxidant, it's an anti-inflammatory, and it prevents programmed cell death. Piperine reduced inflammation and it suppresses the immune system, making it a good candidate for treating and preventing allergies. In mice, piperine reduces sneezing, nose rubbing, and other symptoms of allergies. It dose-dependently decreased histamine, nitric oxide, immunoglobulin E, and inflammatory cytokines interleukin-6 and interleukin-1 beta. It also prevented the release of histamine from rat mast cells, a type of white blood cell, and it decreased inflammatory interleukin-4, interleukin-13, and TNF-alpha production. As little as 5 milligrams of piperine per kg of body weight reduced pain in mice and rats. In humans, this would roughly equate to 1/6 of a teaspoon. Another study in mice showed that higher doses, around 30 to 70 milligrams per kg of body weight, had a similar effect to indomethacin, a pain-relieving drug similar to aspirin or ibuprofen. Rats with high level of fat and cholesterol in the blood lost weight and fat mass when piperine was added to their diet. In addition, piperine increased the number of calories burned by the muscle isolated from rabbits. This increase in metabolism might offer another explanation to why this compound helps with weight loss in animals. And piperine prevented and slowed the production of fat cells. Piperine caused a significant drop in the average blood pressure when fed to rats. In another study in rats, it was able to partially prevent the increase in blood pressure caused by a drug, an NOS inhibitor. High blood pressure causes arterial walls to become more rigid, which is a predictor of heart disease and stroke. In rats, piperine prevented arterial wall from hardening, keeping the arteries youthful, healthy, and flexible. Gallstones are formed from crystallized cholesterol in the gallbladder. Piperine prevented cholesterol gallstone formation in mice by reducing the size of cholesterol crystals and decreasing the transport of cholesterol from the liver into the gallbladder. Preliminary research suggests that piperine allows the body to absorb more nutrients by making it easier for them to pass through the membrane, the inner layer of the gut. It can also increase the surface of the gut that can absorb nutrients from foods, further boosting the gut's efficiency. Piperine prevented diarrhea in mice. In rabbits and guinea pigs, it worked as well as loperamide, another drug used to treat diarrhea, but without causing any of loperamide's usual side effects. It also has antispasmodic activity, meaning it can reduce muscle spasms in the digestive tract. Piperine prevented the formation of ulcer in rats and mice. It was effective against ulcers caused by stress, hydrochloric acid, and the pain reliever indomethacin. Helicobacter pylori is a bacteria that can cause chronic stomach inflammation, peptic ulcers, and in rare cases, stomach cancer. Piperine inhibited the Helicobacter pylori from growing and sticking to the cells, and this may reduce the chances of infection. In many, but not all, rodent models of epilepsy, Piperine reduced the number of seizures and deaths with doses as low as 10 mg per kg of body weight. In skin cancer or melanoma, piperine prevented tumour cells from spreading to other parts of the body or metastasizing, leading to significant better survival rates in the mice. It also decreased the tumour growth and the metastases in mice with breast cancer. Piperine prevented breast cancer with an 80 to 90% efficacy and decreased breast cancer in rats. It slowed the growth of colon, prostate, and breast cancer cells. Piperine may fight cancer in several ways. It may create free radicals in the cancer cells, the same thing that it protects the body against through its role as a powerful antioxidant in normal cells. It can reduce the levels of cyclin B1, a protein that lets cells divide. And it can cause programmed cell death or apoptosis of cancer cells by increasing P21 and activating capsase. In addition, piperine increased the bioavailability of other tumour-fighting drugs, increasing their effectiveness in animal models of cancer. In a study with mice, piperine 2.5 mg per kg reduced the level of thyroid hormones as much as standard antithyroid drugs. This can be good for people who have elevated thyroid hormones. However, reduced thyroid levels in healthy people could be harmful. Low levels can cause symptoms like fatigue, joint pain, and shortness of breath. T cells and B cells are immune cells, and they fight bacteria and other invaders. In mice, piperine reduced the number of T cells and B cells, and it kept the T cells from being activated. When the body senses an invader, like bacteria, it sends dendritic cells to the lymph nodes to activate the T cells. In mice, piperine kept the dendritic cells from maturing, and it made them less able to travel to the lymph nodes. Finally, it reduced the production of molecules that increased immunity, or cause inflammation in response to invasion. Immune system suppression could be harmful to healthy people, but with further research it could help in the treatment of autoimmune disease. On the other hand, piperine can also boost the immune system. In mice, it caused an increase in the production of interleukin-6 and TNF-alpha, signal molecules that cause inflammation in response to an infection. Mice who were fed piperine were less likely to develop a bacterial infection or sepsis. One study looked at the movement of food and liquid through the digestive system in mice and rats. Low doses of piperine, 1 to 1.3 mg per kg of body weight, increased the time that it took for solid foods to travel through the digestive system. There was no change for liquids. Another mouse study showed doses as low as 0.5 mg per kg slowed the time for food to move through the digestive system. Slowing the passage of food reduces hunger, so piperine could potentially help to control hunger and weight. One study in male mice showed that piperine damaged sperm. Piperine increased the number of harmful radicals in the epididymis, the tube where the sperm is stored. It also reduced the number of sperm and their ability to move in the rats. These fertility effects occurred with doses as low as 10 mg per kg of body weight in the rats. Finally, piperine may prevent pregnancy by stopping fertilized eggs from attaching to the uterus. In mice, piperine injections reduce the number of implanted eggs by half. Piperine may increase toxin bioavailability by the same mechanism that it improves supplement and drug bioavailability. Rats who were treated with piperine accumulated more aflatoxin B1, a toxin from fungi that causes liver damage and cancer in their tissues. Keep in mind the safety profile of piperine is relatively unknown. Given the lack of well-designed clinical trials, the list of side effects below is not a definite one, and you should consult a doctor about potential side effects before taking it as a supplement, especially due to piperine's ability to interact with drugs. Piperine is generally considered non-toxic and has few side effects, however. One study with human volunteers reported that piperine caused no adverse effects. Some people reported nausea and gut discomfort when using the supplement. as much as 250 times the average human consumption caused no toxicity in rats. Piperine was once thought to be cancer-causing because it had a similar structure to some cancer-causing chemicals. However, preliminary studies suggest it may actually protect against cancer. As piperine is a bioavailability enhancer, which means it helps the body to make use of other substances, it can also cause many drugs and supplements to have greater effects at even lower doses. As a result, you should always consult a doctor before taking piperine if you're on any prescription or over-the-counter medication. Piperine also enhanced the effects of supplements like beta-carotene, curcumin, and resveratrol. However, it prevented the anti-diabetic effects of curcumin in rats. The regular kind of black pepper that you probably have in your home is about 0.4 to 7% piperine. Slightly lower amounts are found in white pepper, long pepper, and Balinese long pepper. Piperine supplements are sold as both powder and pills. In humans, a dose of 20 mg per day can increase the bioavailability of curcumin. There have been few human studies for other benefits of piperine. However, some doses that were effective in mice and rats. For pain relief, 30 to 70 mg per kg of body weight. To improve brain function, 5 to 50 mg per kg. To lower blood pressure, 10 mg per kg. And for antioxidant effects, 20 mg per kg. Ordinary black pepper is about 0.4 to 7% of piperine. Therefore, to get 1 full gram of piperine from black pepper, a person would have to eat over 6 teaspoons of the black pepper. Unsurprisingly, it's recommended to use piperine supplements for these doses instead. For more information about herbs, supplements, and natural treatment plans, check out my website.